The ash tree, belonging to the genus Fraxinus, has been a significant figure in traditional medicine for centuries. Known by many names depending on the region, including European ash, Fraxinus excelsior, and white ash, Fraxinus americana, this tree has a long history in herbal remedies, especially for treating women's health issues, digestive disorders, and fevers. While modern herbalists are more cautious due to the potent nature of the plant, its place in Materia Medica remains valuable for its medicinal properties. We will look at the ash tree's growth, habitat, identification, and medicinal uses, while also outlining precautions necessary for its safe use. Growth, habitat, and identification. The ash tree is native to Europe, North America, and parts of Asia, thriving in moist, well-drained soils. It prefers temperate climates and can often be found in woodlands, forests, and along riverbanks. Mature trees can grow up to 80 feet tall, with smooth, grey bark that becomes rough and fissured as the tree ages. Its leaves are compound, with 7 to 9 lance-shaped leaflets that are arranged oppositely on the stem, giving the tree its signature appearance. The tree produces small, greenish flowers in spring, followed by clusters of winged seeds, known as samaras, in the fall. Medicinal parts and uses. Please note, this video is for educational purposes only. It is not intended to diagnose, treat, or cure any ailment, illness, or disease. While the ash tree does not have any known edible use, several parts of the tree have been employed in traditional medicine, particularly the bark, leaves, and sap. The inner bark, in particular, is renowned for its dual action as both an astringent and a tonic, making it useful in conditions requiring gentle tightening of tissues while stimulating overall bodily function. Women's health ash bark has been traditionally used to support women's reproductive health. It has been employed in the treatment of PCOS, polycystic ovary syndrome, and uterine fibroids, conditions in which the ash's astringent properties help to reduce excessive tissue growth and inflammation. In childbirth, ash was sometimes used to stimulate uterine contractions and facilitate labor, though its potent nature makes this a dangerous and controversial practice in modern herbalism. Digestive and laxative uses. Ash bark has also been historically used as a laxative, helping to alleviate constipation by promoting bowel movements. Its stomach cramp relieving properties make it beneficial in addressing digestive discomfort and spasms, though its use requires caution due to the potency of the plant. Fevers and infections. In traditional medicine, the leaves and bark were used as remedies for fevers, acting as febrifuges, fever reducers, in much the same way that other herbal remedies like willow bark were used. The cooling, astringent properties of ash were believed to help combat infectious fevers and support overall immune response. How to harvest ash. Harvesting ash bark is a delicate process. The best time to collect the bark is in early spring, just before the sap rises, or in late fall. The inner bark is what is used medicinally, so care must be taken when stripping the outer bark to avoid damaging the tree. Using a sharp knife, the bark is cut into strips and then dried for later use. Fresh bark should not be used due to its high potency, and drying helps moderate its strength. Leaves can also be collected and dried, typically during summer when they are most vital. Cautions and precautions. Despite its various medicinal benefits, the ash tree's potent effects require careful use. The inner bark, while a powerful astringent and tonic, can induce vomiting if taken in large doses or improperly prepared. Because of its strength, it should not be combined with other medicines, as interactions could heighten its effects, leading to harmful side effects. Moreover, the tree's medicinal preparations are not recommended for pregnant or nursing women, as they can cause uterine contractions or pass through breast milk, potentially affecting the child. Similarly, young children should not be given ash bark or leaf preparations due to their delicate systems being more susceptible to its potency. Additionally, individuals with kidney or liver issues should avoid using ash tree remedies, as the strong astringent properties can burden these organs, exacerbating existing conditions. Given its ability to tighten tissues, overuse may strain the kidneys, and its metabolic effects could stress the liver. The ash tree holds a revered place in traditional herbal medicine, with powerful actions on the female reproductive system, digestive health, and fever relief. However, its strength demands respect and caution. With careful harvest and appropriate application, the ash tree continues to be a valuable, if potent, herbal remedy in the Materia Medica.